Stethoscopes and stereotypes, the push for a more inclusive nursing workforce. So, for our situation, there is a lack of racial and gender diversity within the nursing profession. Nursing is mostly made up of white women, and there aren't enough nurses from different racial or gender backgrounds. This lack of diversity can affect how patients are cared for. When nurses and patients come from very different backgrounds, communication barriers and cultural misunderstandings can happen. When there isn't enough diversity, patients may not receive culturally competent care. This can cause patients to feel misunderstood or even lose trust in the healthcare system. Feeling unseen or unheard can make a big difference in how comfortable someone feels in seeking care. Diversity isn't just about representation, it's also about perspective. The nursing profession loses out on so many valuable ideas, experiences, and approaches to patient care when diversity is lacking. Every nurse brings a unique background that can help improve patient outcomes and make care more personal and effective.
I will be discussing the lack of racial and gender diversity in the nursing profession and how it directly affects patient care and outcomes. Nursing is one of the largest healthcare professions in the U.S., yet it lacks diversity both racially and by gender. This means that patient populations, especially marginalized groups, may not receive culturally competent care. Culturally competent care means being aware of and respecting a patient's cultural background, language, beliefs, and values during treatment. Without representation, healthcare providers may unintentionally overlook or misunderstand cultural backgrounds, leading to poorer outcomes for patients from minority backgrounds. Why does this situation exist? Historically, nursing was viewed as a profession for white women, and minorities were often excluded from nursing schools due to segregation and bias. Systemic inequities, economic barriers, and limited access to quality education have also restricted opportunities for underrepresented racial and ethnic groups. Gender stereotypes. Gender stereotypes have further perpetuated the idea that nursing is a female profession, discouraging men from pursuing nursing careers. Need Is there a need for change? Well, research from AACN, NLN, and NAM has shown that diverse healthcare teams improve communication, trust, and treatment adherence among patients. Studies also reveal that when patients receive care from providers of similar racial or cultural backgrounds, they are more likely to feel heard, respected, and satisfied. Currently, over 80% of registered nurses in the U.S. identify as white and female, which does not reflect the diversity of the patient population. What's the current practice and background? Well, many institutions have implemented DEI initiatives, mentorship programs, and pipeline programs, such as the Health Resources and Services Administration, also known as the HRSA, Nursing Workforce Diversity Program, and this recruits students from underrepresented backgrounds. HRSA stands for the Health Resources and Services Administration, and it's an agency that supports access to health care and promotes workforce diversity. Cultural competence training is now integrated into nursing curriculum to prepare future nurses for diverse patient populations. The AACN DEI guidelines recommend setting measurable diversity goals within nursing programs, providing cultural humility and implicit bias training for healthcare providers, strengthening recruitment and retention of minority and male nurses, creating inclusive academic and clinical environments. Improving racial and gender diversity in nursing is essential to achieving health equity and cultural competent care. Addressing these disparities will not only strengthen the nursing workforce, but also improve patient trust and outcomes across all populations. As future nurses and healthcare leaders, we all play a role in fostering inclusion, mentoring diverse students, and advocating for systemic changes.
The nursing workforce is not as diverse as it should be, and there are many factors that contribute to that. The first factor is the lack of financial support, academic preparation, and mentors. Many potential nursing students from underrepresented backgrounds face financial challenges. This makes it difficult to pursue or complete nursing programs. Some of these students may also come from schools with limited academic preparation or exposure to nursing as a career. These students also lack mentors or someone they can look up to that is in the nursing field. This results in a smaller number of minority students entering and completing nursing programs. Another factor is the work environment not being inclusive. Once these students enter the workforce, they experience an environment where they feel undervalued, isolated, or excluded from opportunities for advancement. This results in a lower job satisfaction, increased turnover, and fewer diverse nurses in leadership roles. Implicit bias is also a factor. This is unconscious attitudes that influence decisions and interactions. This can affect things like admissions, hiring, evaluations, and even patient care. Due to the lack of diversity, we propose a mentorship program. The stakeholders are individuals or organizations we would collaborate with to make the nursing workforce more diverse. The first stakeholder is minority or male population. This population represents our primary audience for the mentorship program. Nurse mentors and diverse background are also a stakeholder. They are the foundation of the mentorship program. They will provide guidance, encouragement, and real-world insight to students with similar backgrounds. Their experiences will help our mentees navigate challenges and strengthen their professional identity. Educational institutions are also stakeholders. This includes high schools, community colleges, and nursing programs. They will help identify potential students and provide academic support. Healthcare organizations are also a stakeholder. Their involvement is essential for providing mentorship opportunities, clinical placements, and professional development. And last but not least, our last stakeholder is patients of minority population, and they are also our most important stakeholders. We will now discuss how our project fit in the three components of the nurse sensitive indicator. The structure is the program itself. The process involves enhancing preparation, retention, and engagement of minority nursing students through consistent mentorship. The outcome focuses on the result of these efforts. These mentorship will improve diversity. We aim to achieve better quality of care, reduce health disparities, and higher patient satisfaction. If we fail to make the nursing workforce more diverse, it can pose some risk to our patients. These risks include delayed improvement. It also includes miscommunication, as language and cultural barrier between nurses and patients can lead to miscommunication. We will also see unequal care because without diversity and cultural awareness, there is an increased risk for unequal care across the different patient groups. Also, you will see a decline in trust. Trust is important for effective care. Patients are more likely to share information, follow medical advice, and return to follow-up visits if they trust you. Some resources that we would need to make our mentorship program successful is a program coordinator and diverse mentors. We will also need adequate funding to sustain the program, outreach materials such as flyers and brochures to help us recruit students and mentors. We would also need training for the mentors and career guidance for the mentees. This include resume help, interview preparation, and exposure to nursing specialties. We would also need healthcare organization agreement. This is a partnership with healthcare organizations such as hospitals, clinics, or public health agencies. We would need a data collection plan. This is to evaluate the program's effectiveness and measure outcomes. That way we can identify areas of improvement.
So for the recommendations, I have a number of points here, some of which I have attached references from some scholarly articles that I saw during my research. The first two being inclusive recruitment within underrepresented populations, as well as making nursing education more accessible to marginalized groups. I believe that partnering with local high schools, community organizations, as well as public health organizations to not just recruit and promote nursing, but also offer scholarships, mentorship programs, and just grants could possibly make nursing education more accessible to someone that might not have sought out a nursing degree due to financial hardships. Based on a number of studies that I saw during my research that I've referenced, when we hire more nurses from different ethnic and racial backgrounds, we're actively improving health outcomes for our patients and decreasing health disparities due to whether conscious or unconscious biases through the way we offer care. As for scholarships and offering financial grants, during my research, I saw a list of scholarships that I saw two scholarships that caught my eye. The first one being the Foundation of National Student Nurses Association. This is given by Duke University School of Nursing. It's a $10,000 per academic year scholarship for nursing students, whether it's for an associate's, a bachelor's, an accelerated BSN, or an RN to BSN program. It's specifically for Black, Indigenous, or people of color. And then there's another scholarship given by the National Association of School Nursing. It's called the NASN Diversity in School Nursing Scholarship, which is also targeted at underrepresented groups that might be facing financial hardships. For our third point of incorporating cultural competency and humility training, not just in nursing school, but also for nurses that are practicing in the profession. I think while it's important to recruit diverse people within this profession, it's also equally as important to teach nurses on what is expected of them as a nurse. I think that patient care isn't a one size fits all kind of deal. So, addressing the fact that you will most likely be taking care of a patient from a different cultural background, a patient that may believe in something that you don't believe in, may practice something that you don't practice. It's extremely important to put those biases aside, whether intentional or unintentional, or conscious or unconscious biases. Put those aside and practice cultural awareness and humility in order to let every patient you're taking care of feel safe and heard. And then for the final point, to improve inclusive leadership in every level of nursing, I think it's important to let nurses know that you are not expected to just be in one position throughout your whole nursing career. If that is the route you decide to take, that's fine. But if you are interested in seeking out leadership positions, that's also 100% encouraged. We don't want nurses, whether new or seasoned, to feel like leadership positions are only exclusively, saved for certain people. So I believe it's important for HR and nursing leaders to encourage our nurses to do those leadership programs, do those courses that you need in order to be that in order to gain certification, to be that diverse representation in leadership. And this doesn't just go for, people, nurses from different racial backgrounds, ethnic backgrounds, but also males, and letting them know that, like, you can be that male representation, not just in nursing, but in leadership positions as well. So, for the process, we try to come up with realistic and achievable ways to implement our recommendations. The first one being incorporation of mentorship programs. That was the intervention that we chose in part one of our project. I just believe that in order for these recommendations to work, we first need to gain support and data at a local level. And by that, I just mean speaking with representatives from our local hospitals to see exactly what those diversity stats look like, to know what we're working with, as well as also knowing if they offer existing mentorship programs that we could possibly collaborate with. I also feel like in order for this to work, we need to come together and formulate a plan on how we're going to attract people to this, how we're going to get the word out there, how we're going to make this a successful thing. I came up with the idea of maybe gathering a couple nurses and nursing students who volunteer for this mentorship program, and just partner up with our local public health organizations and go out within the community and do, these mini health fairs where we're offering free screenings, as well as letting our designated recruiters go around and speak to people to see who would be interested in this mentorship program, who's interested in being a nurse, so that while we are possibly gaining and enrolling members into our program, we're also giving them something they could benefit from by offering them free care. So it seems like more of a personal thing instead of just coming in trying to recruit people. As I also said in the previous slide, while it's important to recruit diverse workers, it's equally as important to let these potential future nurses in the program, or nursing students, or even nurses within the nursing career already, it's important to let them all know what is expected of them as a nurse. So, with a job like this, you will be spending hours with your patients during your shift, sometimes multiple days within the week. So it's important to know how to conduct yourself in the event of taking care of a patient who is of a different background than you, with different beliefs as you. Within these mentorship programs, we should have courses that exaggerate the importance of how biases, whether conscious or unconscious, can impact the way you care for your patient, and how it could potentially increase health disparities on your unit. And then finally, for the final point, we're basically evaluation. In order for any project to work, we need to know what went well, what didn't go well, and what we can do to be better. So I proposed a 4-month evaluation where all the designated leaders come together and just discuss what's been happening in the past few months, what went wrong, what went really well, and again, what we can do to improve. I also think that those leaders should come together at the very end of the mentorship program, so we can have the raw data of all the people that were enrolled in the program. From that group, how many of them have applied to nursing school, how many of them are about to apply to nursing school once they graduate from high school, and just things like how they felt about the mentorship program, getting honest reviews from the people that, experienced it for however many months it goes on for, and to just know what they would change, what they think could be better, and the things that they think went really well and left a lasting impact on them to help them, see all the possibilities to the world of nursing.
Our short-term outcome for our program includes increasing the underrepresented minority nursing student enrollment, a more diverse mentor pool, and improving staff cultural competence by using the targeted training will strengthen the intercultural skills. So with the increase of diversifying the nursing workforce, it helps boost communication between patients and healthcare workers. It has also proven to improve workforce retention. Some long-term outcomes for our program are improving patient satisfaction and trust, as there will be a more diverse, culturally competent nursing team that will enhance communication and trust. This will lead to a higher patient adherence and satisfaction. Our program will also reduce disparities and provide better quality of care, as a represented, diverse workforce advances a healthy equity with providers to advocate and effectively serve the underserved communities. It is a feasible outcome, as we will partner with local communities and schools to build a connection. So building with local public health organizations, hospitals, communities, and schools can co-sponsor mentorship pipelines that can increase the minority student recruitment and success. So community engagement is a big concept within the minority populations with diverse backgrounds. So community members will be most likely to engage in local events and services when they feel a part of the community, due to trusting nurses who share the same beliefs or cultures as they do. With our program, we will implement in stages of mentoring, training, and outreach. So there will be a regular 4-month evaluation cycle that can be enabled to adjustments and sustain the progress of diversifying the nursing workforce.
Ethical considerations. To demonstrate ethical behavior in the project, the core ethical behaviors in the project will revolve around the principles of non-maleficence, or doing no harm, and fidelity, which is keeping promises and being loyal. To start off with, integrity and transparency. We're going to ensure clear, upfront communication with all participants, minority students, diverse mentors, and collaborating institutions regarding the program's goals, time commitment, and use of data. This demonstrates fidelity by building trust and ensuring all stakeholders understand their roles and program limitations, preventing false expectations. Conflict of interest management, or non-maleficence. We're going to establish a formal process for vetting and matching mentors to minimize the risk of undue influence or exploitation. Ensure mentors are trained not to use the relationship for personal or institutional gain. This protects vulnerable participants from potential harm and maintains the ethical focus of the relationship. We're going to ensure equity in this project by focusing on targeted, inclusive outreach to minority and male populations as outlined in our recommendations. When selecting students for scholarships or grants or the program, we're going to use objective, predetermined criteria that prioritizes with those with the greatest financial need and those from underrepresented backgrounds rather than subjective biases. This operationalizes justice by actively correcting historical barriers and ensuring equal access to programs' benefits. Culturally safe and humble training, beneficence, and justice. Our implicit bias and cultural competence humility training for mentors and staff must be mandatory and ongoing. It must focus on power differentials, not just superficial cultural facts. This ensures the environment created by the program is one of equity, where diverse participants are respected and the program staff is equipped to challenge their own biases. Protecting participants in the project. Protecting participants primarily relates to the ethical principles of autonomy, or respecting choices and ensuring confidentiality. Informed consent and voluntary participation. All participants, students or mentors, must provide informed consent to join the program and understand that their participation is voluntary. They must be clearly told that opting out will not negatively affect their academic standing, employment, or relationship with the affiliated institutions. Demonstration. This protects the participants' autonomy, their rights to choose participate, which is a fundamental ethical standard in any program involving people. Data confidentiality and anonymity. When collecting data for our 4-month evaluation, we must anonymize surveys and aggregated data, or whenever possible, to protect individual privacy. This protects confidentiality, ensuring that feedback, especially critiques or negative comments, can be given honestly without fear of retribution, thereby protecting the participants from harm. Safety and reporting mechanisms. We're going to establish a clear, confidential reporting structure outside the direct mentor-mentee relationship, where participants can report any experiences of discrimination, biases, or unethical behavior without fear. Demonstration. We're going to provide an essential safety mechanism that demonstrates a commitment to non-maleficence, ensuring that the project environment is safe and accountability is maintained.